Sure.
What are the key problems which are faced by newborns today, which you see in your practice?
So I think one of the most important set of factors immediately is the fact that we now have a good incidence of prematurity coming up. In the past, I suspect we did have the same numbers, maybe a bit less, but the survival was not so certain at that time. Today, with advancing science, more experience, the survival of these preemies now is obviously on the uprise. And obviously with that are the possible side effects of prematurity itself. So that is a very important issue. The other thing is, though we say prematurity accounts for hardly 10 to 15% of all our babies, low birth weights or small for gestation age, I'm going to use them interchangeably because we are at a decent common level of education. That incidence is quite high. So that's as much as almost 15 to 25%.
One of the key things that we see in newborns is the traditions that we follow in India. So there are practices which range from massaging with oil every day, sometimes too vigorously. Sometimes it is, applying besan to lighten the skin, to remove the hair, and even mustard oil in the ears if in case there is a earache. What do you recommend when it comes to these kind of traditions?
So our medicine, actually ancient medicine, was pretty robust. And I think the reasons for doing or carrying out these practices have actually gently been corrupted over the ages, where we do not understand the primary reason why something was done, or more importantly, how it was done. So oil massage is definitely good for babies. There's no doubt about that. But the way we do the oil massage is very important. So if we are going to try to get the upper layers of the skin and the hair off the baby, it's a traumatic experience for a baby. And that is not the reason why we do oil massage. What is important to understand is the oil massage was done as a touch stimulation. So we need to gently do this, not just rub the baby all over the place, but gently move our hand, caress the baby. And the oil is to be used only as a lubricant, not as a removal agent, which we normally see. Second thing is, of course, over the time period, the people doing the oil massage are different now. So I always put up an example that the lady who does the oil massage comes from a lower socioeconomic standard, living in challenging circumstances, not trained except by pure experience. Zero knowledge, but pure experience in conducting the oil massage. So that obviously is not going to be as positive as a member of the family, herself or himself, doing the oil massage gently. We love our children, we are not going to hurt them at all. While it's set in the mind of the professional masseurs, as I would say, is that you need to rub the baby through and through at whatever be the circumstance. So that was one thing. Which oil to use? I think that's a huge challenge. So we've gone from coconut oil to groundnut oil to mustard oil also. Not only in the ears, the same oil is applied all over. Many of these can be pretty caustic actually. So they can actually create problems for the baby. The hygiene and cleanliness of the oil itself is also challenging. If it's unclean oil, then obviously it's going to create a problem. So besides an allergic reaction to the rather acidic oil, I would say, or to the intense oil, as I would put it, it's also going to be a question of hygiene of using that oil. And oil is a good substrate for bugs. So if it remains on the body for too long or is stagnant for too long in bottles, the risk of skin infections would increase in these babies. So we need clean oil, whichever oil it is. I think each area has got its own oil base. We used to say a lot that olive oil is the best for the skin. However, I do believe that there are now challenges, and somehow we are now percolating to a group of mixed oils or coconut oil, whatever it is. I think it depends on the region, but we need to do it gently. That is number one, to be used as touch stimulation and not as a rubefacient. And hygiene should be taken into consideration.
The last hour. Anything can happen between the bells. But what happens during the last hour is what matters the most. The biggest market swings. A close-up look at what's driving them and how the investors are reacting. Watch the most seasoned market mavens guide you through the most important hour of the trading day. NSE closing bell. At these times, only on CNBC TV 18 and CNBC-TV18.com.